Hello, mommy. Welcome back to Pregnancy Week by Week. And today is your week 18, your 18th week of pregnancy. And 18th week of pregnancy is just 5 months of pregnancy. So you have about 4 months to go. Congratulations. So in this video, we'll be talking about a few things that you need to know in your 18th week of pregnancy. So we'll be talking about dealing with backaches, heartburn, iron, and relaxing. I'm not talking about relaxing like relaxing. I'm talking about relaxing hormone. That same hormone is the hormone that loosens the ligaments that holds your bone together. So we'll be talking about a lot of things and how to handle them and what happens to you at week 18 as well as what happens to your baby at week 18. So without further ado, let's just get right into business. Hi, my name is Javita Ola. This is a research-based channel where we discuss everything women. So if you are a woman and you think there are a lot of things that you need to know or you need to, get the world to experience through your own message, this is the channel for you. So you might consider sticking around by hitting the subscribe button. Don't forget the notification bell. You just have to hit that too. There will be a lot of topics that will be discussed here, and we'll be needing a lot of contribution from the viewers and the subscribers and anyone who finds each topic interesting. Week 18 is when you get your first scan. Like I said earlier, I do my own a little earlier than that. I don't wait that much. I can be very curious whenever I'm pregnant, but this is the most appropriate time for you to do your scan. If your medical practitioner feels there's absolutely nothing wrong for you to do your scan at a little earlier, that's between you and your medical practitioner. But right now, this week is the best time for you to have your scan done. Now, your baby is about the size of a cucumber and your womb has enlarged even more. So just like I said in week 17, people would definitely know you are pregnant and you'll be having a lot of positive emotions around you, but don't expect everything to be positive because some people may be disappointed. It's just an individual difference, so you don't have to take it to heart. Before the scan, you may be asked to take a lot of water. A good amount of water, and you may be asked not to go. You would definitely be asked not to go to the bathroom. This will help the scanner to be able to see your baby properly, because the larger your bladder, the more obvious your baby is when they're taking the scan. I've never been able to handle the scan myself, and a lot of mothers will attest to that, but we only see it ourselves that the more we are pressed the easier it is to see the baby. There must be a reason for that, and that is just to make your bladder bigger, to lift your uterus a little bit. But it can also be an uncomfortable weight for you. Backaches. What you may experience around this period is backaches because your lower back is thrust forward like this and your uterus comes to the front. So you have this figure of, that's why it's very easy to tell that somebody is pregnant by looking at the person from the back. Well, not everybody knows that, but when you know somebody's posture and the person starts changing, even when it is not so protruded, you can actually tell that somebody or a woman is pregnant. So this is exactly what happens. The lower back thrusts forward and the uterus comes to the front, and you're like this posture. And I'm sure you're experiencing the same thing. Just look at yourself and that's exactly how you look. This is also coupled with the obvious changes that the hormone relaxin is instituting. It relaxes your ligaments, including those that attach your pelvic bone to your spine. It also loosens your joints and your posture will definitely shift. So now you know the reason why you might not be able to escape the back pain. Reducing heartburn. At this stage of pregnancy, sometimes the most harmless food can set your guts on fire. But heartburn is a symptom that persists throughout your pregnancy. But please follow these principles. Number 1, eat slowly and chew thoroughly. Now, I'm sure you've been wondering, imagine chewing rice and you're chewing and chewing and chewing. There are people who actually like to swallow their food immediately. In fact, I've tried swallowing rice before and I think it's tastier than chewing the rice. But as far as pregnancy is concerned and your heartburn is concerned, apart from rice, there are other foods that you might want to eat, especially when you're taking fruits and fiber. Imagine just chewing sparingly and swallowing it. You're giving your stomach or your guts, your digestive system more work to do. In as much as the fiber is supposed to help you with digestion, you have your own part to play. You chew thoroughly and slowly you swallow and give some room. Secondly, do not eat in a rush. It's just as good as saying eat slowly. Yes, I know I've said that again. I am only emphasizing it. Keeping it on its own. Do not eat in a rush. It's actually important for you to more like divide your food into two. If you have a particular portion that you would have taken on a normal day, you can divide it into two and take it at different sessions, giving room to your belly to be able to do the activities that it is best at doing. Thirdly, it is best to snack than eat a full plate. Snack on maybe crackers, biscuits, fruits, than eat a full chunk of food. So I hope I have been able to emphasize that enough, because that's the only way that you can be able to comfortably walk the steps within this period of heartburn. After eating, you should sit upright for a few hours for as much as you can last without just lying down. You don't just go to bed after eating. You can actually use the pillow to keep yourself up if you're tired of sitting up or you're tired of walking about. Well, it's actually essential for you to walk about, even if it means walking outdoor to receive some oxygen, because it helps to digest your food too. And with that being said, please stay away from spicy food. And that includes pepper or all sort of spices. If you must do that, do it sparingly. Just take you just have a few time left. Help yourself to be comfortable enough to complete this journey and get along with your life. Iron intake. Take iron. If you're somebody who sticks to plant-based food, then you need to take iron supplements. Please consult your doctor. Don't go across the counter to get it. It should be something given to you in the hospital, because you're going to be scrutinized and there must be professional reasons for you to take iron. Well, this is because you are at a high risk of iron deficiency anemia. So there are foods like beans, soy products, oats, barley, pumpkins, etc. that are rich in iron or have some quantity of iron in them, which you might eat, but you still require to supplement the iron. The list goes on quite all right, but how often do we put it in here to ensure that we eat the exact food that will make up for the deficiency we have? We just eat as we require. We eat as we crave. We eat as we have available. So if that's the case, you may not be able to specifically have those foods around and say, now they all have iron, I'm going to eat this today, eat the other one today, and eat the other. No, it doesn't work that way. Since you know it doesn't work that way, the best thing to do is to get a supplement. And you have to do that with the help of your doctor. Time for relaxing. Not relaxing like relaxing. I'm talking about relaxing. I'm talking about the hormones that loosens the ligaments that holds your bone together. This results into an achy pelvis and hips, and sometimes it makes your feet bigger. But guess what? You thank relaxing when it is time to push out your baby's big head. So mommy, what's happening to you? Your baby's sex will now be determined by the ultrasound, so long as your baby's genitals are in view. If it is a boy, the penis will be visible, and if it's a girl, the reverse is the case. You may have trouble sleeping and you require a pillow to make you as comfortable as possible. Now on Amazon and in so many shops, probably shops around you, that's if they have it, there is a kind of pillow that, is it called a maternity pillow or a pregnancy pillow? It's just like a human being. You can place your head, you can place your belly. You know, sometimes in pregnancy, your belly feels so heavy, you need to use a pillow to support it and support your head. Those pillows are actually created that way so you can actually sink yourself in. It's just as if somebody is hugging you. You can place your head, place your belly, position your back, and it makes it very easy. But if you cannot afford it, you can always use the pillows you have in your house. Talk to your partner. Let your partner release the pillows to you. Let your husband release your pillows to you, his pillows to you. And you can even get more pillows provided you get yourself comfortable within this period. It's just a short period before your bundle of joy arrives, so it's worth every investment, it's worth every time, and it's worth every discomfort. Your uterus moves higher above the pelvic bone, and more of your abdomen shows above your waistband as your pregnancy develops. So what's happening to your baby? Your baby is 5.5 inches long from crown to rump. Your baby is large enough for you to start feeling twisting, rolling, punching, and kicking going on in your womb. The art of yearning is being mastered by your baby, and you can even notice hiccuping too if you have the chance to see it when the scan is going on. Your baby's nervous system matures rapidly once you are 18 weeks pregnant. This shows the baby's nervous system as it matures rapidly from week 18. A network of nerves covered with a substance called the myelin that helps to speed up messages from nerve cell to nerve cell are forming more complex connections. If your baby is a girl, she already has 2 ovaries containing 7,000 eggs, and as she gets along in the pregnancy, these eggs will keep reducing in number, but at birth, she will have about 2 million eggs, and she will probably release 400 to 500 eggs in her lifetime. Your baby may be startled by loud noise, causing movements that you will feel. So if that's what it is that your baby really does hear, don't worry, always be happy. So we've come to the end of this video. I hope we've learned a lot, and I hope this has helped in any way. If it has, please do share the video and let other people learn from this. If you have any comments, kindly put it below, and let's see in week 19. Bye.